Good afternoon, everybody. We'll give you a couple minutes for you to jump on, and then we'll get started. Got a great presentation for you today. Perfect. I hope nobody can hear the leaf blower going on outside my window. If you can, I apologize. Timing is everything today. But all right. Well, I don't want to waste too much time here. And I'm going to go ahead and get started because I know Andrea has a fabulous performance presentation for you today. It might be a performance too, we don't know. First of all, I want to say thanks to everybody for joining us today for the November webinar. It is putting ADHD into focus and treating the root causes of attention and focus disorders. So I know this is a great topic. The presenter is Andrea Pittman. She is with the Nectar group and she has presented for us previously. So if you're curious after this one, you can go back to all our previous webinars and look her up. I know she's in there. Quick rundown on what's going on here at Harmony. Let me get my slides. We were just talking about technical difficulties and what do you know? Right, there we go. For those of you who are new to the webinar, Harmony is nestled on a 43-acre campus near the Rocky Mountain National Park in the town of Estes Park. We are a residential rehab and we offer a comprehensive treatments for adults and their family members. We believe that long-term recovery from alcohol and other drugs is possible. With over 50 years of treating addiction, we have fostered a generation of long-term recovery who supports our clients and families for a lifetime. Our staff at all levels work together to create a community of recovery support. We are a 70-bed residential treatment program. We do have a medical detox and an IOP program. If you would like more information about any of those programs, please feel free to reach out to our admission staff at 866-686-7867 or visit our website. There's plenty of information to be found there as well. A couple of things before we get started. We do record these webinars. It will be up on our website for anybody to revisit if you choose. Give me to the end of day on Friday. It should be there. We also have a survey, and I know there was a delay last month on getting the survey out to you. Hopefully that won't be an issue this month and we can get it nice and prompt. We appreciate you, we appreciate those of you who do fill those out for us because it gives us a good insight as to what types of presentations you're looking for and how we're doing overall for this series. We will send you a certificate by email. It will come by end of day November 19th. I know last month that was also delayed. That was out of my control. I apologize and thank you for your patience. This month we are on target. You will have them by end of day Friday. If you do not for some reason, please reach out to me at the email on the screen. Thank you so much to the Nectar Group and Andrea Pittman. We are so grateful for the partnership. I want to also mention that we will be answering questions along the way. I will kind of keep an eye out for them in the chat box in order to not delay the presentation. If you don't get answered at the time that you are typing it, we will certainly make sure we get to you at the end of the presentation. We want to answer all those questions. So your presenter today is Andrea Pittman. She is the Executive Director and founder of the Nectar Group. She has over 17 years of experience working with children, adults, and families through cognitive skills training, consulting, and teaching. Andrea received her education and teaching certification from Southwestern University. She has consulted with over 80 learning programs across the U.S. to help improve client outcomes. With a rich background in education and neuroscience, she has always striven to pinpoint the root issues of learning challenges and create comprehensive plans of action to help clients achieve excellent results. She is particularly interested in integrative approaches to improve brain health and function and general well-being. She is currently completing her national board certification as an integrative wellness coach. She enjoys cooking, the arts, reading, listening to podcasts, and snuggling with her 2 cats. If you are looking for any more information about the Nectar Group and the services they provide, please visit their website, and I'm sure we will have all her contact information up on the last slide of the presentation. So now that I'm out of breath, we are going to turn this right on over to Andrea, and she is going to get started.
Perfect. Thank you, Christy.
Let me get my, again, technical issues. Christy, there we go.
You good?
Let's see, was I not sharing that whole time?
We're not.
I guess I wasn't. So y'all missed my slideshow.
Yeah. And can you see mine? Let me verify.
Yes,
Perfect.
I can.
Awesome. Well, I'm so glad you guys have joined us today, and I'm excited to dig right in. I am just going to take about a minute, maybe minute and a half, to share with you who the Nectar Group is, so you know what we do and where I'm coming from. That'll kind of give you some context, and then we'll dig right into the content that you came for today. Our services are a little bit unique. We're one of only 7 clinics around the country that do what we do. So I like to give you some context for that. So the Nectar Group's an education company dedicated to helping people overcome learning challenges so that they can reach their full potential. We have an assessment-driven process where we use scientific tools to evaluate and pinpoint the root causes of learning difficulties, and then we create custom solutions utilizing cognitive neuroscience to resolve those issues. And we optimize learning and take a really holistic approach to improving both school, work, and life performance, actually, by providing several different types of services. Our most foundational is our therapeutic interventions that are grounded in neuroscience. We use these to treat the causes of learning difficulties for all ages, not just help people accommodate or compensate for them, but actually treat them. We provide K through 12 and collegiate level academic tutoring in reading, writing, and math to build solid content and prepare students for college and beyond. We do study skills and executive function coaching to ensure successful student outcomes, and we provide one-to-one educational services via educational consulting, individualized schooling. We have a program called Nectar Academy where we actually will take over and teach someone and provide their schooling for them one-to-one while they're in recovery or in other types of treatments, and homeschool support for kids who are in that stage in their academic career. We work with people of all ages. We start with kids as young as 4. Our oldest client is currently 74. And we work with people with all types of diagnoses: ADHD, dyslexia, autism spectrum, twice exceptional, traumatic brain injury, addiction, really anything that's brain related. We also work with clients who want to gain a competitive edge for college or the workplace, and we provide all of our services to clients around the world through our unique e-coaching services, which are telehealth services. So we're based in Greenwood Village, Colorado, for those of you that are local, but we have clients all across the country. Our furthest away client currently is in Ecuador. So as long as you have internet, we can certainly help. So with that, we will dig right in and start by looking briefly at the way ADHD presents. So this is probably familiar for many of you that are here today. So we'll just touch on this part briefly, but I do think it's important to have some common vocabulary and make sure we're all talking about the same thing, I should say. So we'll look at a couple of definitions of ADHD. The first one is ADHD is a developmental disorder consisting of difficulties with attention, distractibility, and impulsivity, kind of the hallmark traits we think of, right? It's thought to be a disorder of executive dysfunction. So executive functions, you're probably all familiar with this, but they can be described as the central processes that are involved in giving organization and order to action and behavior. A good analogy is that it's a maestro who's conducting an orchestra, or sometimes we think of it as air traffic control at an airport. Sometimes people refer to this excuse me, as the CEO of the brain. Some examples of our executive function skills are planning, the ability to inhibit or delay responding to stimuli, and certainly emotional control. There is a researcher and a physician named Dr. Sandy Newmark. He wrote a book. I actually have it sitting here because I was just showing it to a client. It's called ADHD Without Drugs. It is a fantastic resource. A lot of the suggestions and information I talk about comes from his research. He's at UCSF. But he says a more interesting way to think of ADHD is as a disorder of self-regulation. It's not just that children, you could put in adults here as well, can't inhibit their impulses, but they have trouble both activating and fine-tuning their behavior, attention, and emotions. This explains why children who cannot get started on or finish their homework but can focus on Legos or their stamp collection for hours, why that happens. We all know adults and children with ADHD who can hyper-focus on something they're interested in. And their natural interest simply doesn't have to be regulated for those activities in order for them to pay attention. So super important to keep in mind. There's 3 types of ADHD, and for all types, the diagnostic criteria says a few things. We'll highlight the big ones. And this is that symptoms must be present before the age of 12. It doesn't mean that you can't get, you might get diagnosed later on in life, but the symptoms for it to be true ADHD do need to occur before the age of 12. Now, you may have other ADHD symptoms that have occurred later in life, but they're considered to be due to something else like trauma, brain injury, substance abuse, etc. The diagnosis cannot be made if symptoms are presented initially for the first time later on in life. And symptoms must also be present for 6+ months and in multiple settings. It can't just be at work or just at school. And then all types of ADHD, all 3 types do occur on a continuum. It can be mild, moderate, or severe. And our goal of treatment, as we talk about that in a few minutes, is going to always be to move someone from the more severe end of the spectrum to the mild end of the spectrum. So the first type that we'll look at is inattentive presentation. This is what many people refer to as ADD. There is actually no official diagnosis called ADD. The DSM has it as ADHD inattentive type. And so if you hear that term ADHD, we're covering that as we go through this presentation. When I reference ADHD from here out, I'm talking about all 3 types of presentation. The common symptoms of inattentive presentation, though, are zoning out, being easily distracted, making careless mistakes. The person doesn't seem to listen. I always say these people get told, like, pay attention, listen, look at me when I'm talking, dial in, get with the program. These are the kind of the mantras they hear their whole life. And they can seem to be absent-minded a lot of times, sometimes also described as daydreamers. The next type of ADHD that we'll look at is hyperactive presentation. This is what we think of when we think of stereotypical ADHD, right? This is the bouncing off the walls, restless, fidgety, the person who sits in the meeting next to you, clicking their pen and bouncing their knee, or who maybe has to get up and down 20 times to go to the restroom or to get coffee. They're always moving and frequently behave as if they run by a motor. They'll often describe like rapid thoughts and difficulty, focusing in on where they're supposed to, managing distractions. Oh, Christy, you're muted.
There we go. It wouldn't let me unmute for a minute. We do have a question.
Perfect.
So Jack has asked, can someone have traits before age 17 without actually having the diagnosis?
That's a great question. And so I think the easiest way to answer that, or maybe the simplest way to think about it, is that they can have traits, but not have true ADHD. So, all of us, right, have days. To take it to kind of a more mild spectrum, even if you don't have ADHD, I definitely don't have ADHD, but I definitely have days where I don't focus as well, right? Like I have symptoms of ADHD, or I have in circumstances or in situations where I may have symptoms of ADHD. Certainly if there's other exasperating kind of situations going on, like I'm not getting sleep, I'm not eating well, I'm not hydrated, those kinds of things. And so just because you have symptoms of ADHD doesn't mean you have ADHD. And this is where accurate diagnostics come into play, which we'll talk more about in a minute. Perfect. Please keep asking questions. I'm happy to answer them as we go through. So The third type of ADHD is combined. So it's simple. It's just you've got both. You get a left and a right. So you've got you've got 6 for children. You've got 6 symptoms of both categories. And so you'll see it show up in different circumstances, different ways with different symptoms. So now that we've we've defined ADHD and the basic diagnostic guidelines, let's actually look at the root causes of ADHD. So when we look at the diagnostic criteria, and to kind of piggyback on Jack's question, we can see that ADHD is essentially a diagnosis of symptoms. But in order to effectively treat ADHD, we need to really understand and tackle the root causes rather than focus on the symptoms. So when I get a new client that comes in or I'm speaking to someone doing an intake and they're like, I have ADHD, can you help? The answer is it depends. It depends on what that means. When you say you have ADHD, it's kind of similar to saying you have a stomach ache. Like that could be caused by a lot of different things. Maybe you ate something bad for breakfast. Maybe you have an ulcer. Like the way we treat it is going to be dependent for effective treatment on what is actually at the root. So to begin to understand this, I'm going to share with you a graphic that we use all the time at Nectar. And we call this the potential pyramid because we find for people to really reach their full potential academically, in the workplace and in life, they need all 3 tiers of the pyramid working well. And if you've been in any of my webinars or trainings or workshops, you've seen this before because I use it every single time. It's so important. At the foundational level are the cognitive skills. You can think of these as similar to your computer processor. They're always working in the background. They would allow you to take in information, process it, pay attention to it, make sense of it, and save it for later retrieval. And these are the skills such as processing speed, short-term memory, long-term memory, and the featured skill of the day we're talking about today, attention. So our second tier is our content. This is more like our knowledge bank or our database. For a student in school, this could be reading, writing, math, science, history. For adults, it becomes job skills, position-specific information, writing and communication skills. Or it can even be, if you think about hobbies, it can be something such as, how to cook or how to play board games or whatever knowledge we're acquiring. And then finally, we have on the third tier, our behavior. And this encompasses a lot of skills. It could be grit, work ethic, motivation, self-confidence. It's also our executive function skills like time management, organization, planning, and prioritization. So we know that if there are deficits on tier 1, then tiers 2 and 3 are negatively impacted. As mentioned earlier, ADHD is a disorder of executive functions. However, those deficits in executive functions are primarily caused by a weak foundation of poor cognitive skills on tier 1. Looks like we have a question from Christy, so I'll grab that.
We do. So Jill has asked, Dr. Benjamin Amen defines 7 types of ADHD. Is this a different perspective than what you outlined with the 3 types?
Yeah, great question. If you're not familiar with Dr. Daniel Amen, look him up. He has some of my one of my absolute favorite TED Talks called, it's in the name, it's something about like what 83,000 brain scans have told us. That might not be the exact title, but you'll find it that way, just as a little side note. I used to work with Dr. Daniel Amen out in Southern California. I ran a clinic next door to his clinic, so I've worked and collaboratively with many patients. But what we see is that he does segment ADHD into 7 types. The reason I'm not talking about those 7 subtypes today is that I'm talking about from a diagnostic criteria from the DSM, which are those 3: inattentive, hyperactive, and combined. And so when we go to diagnose, those are going to be the only recognized diagnoses, like for insurance purposes and for medical records. So when we look at it diagnostically, we look at that. When we look at it from a treatment perspective, he's classified those differently based on different patterns of brain activity. If you're not familiar with him, his kind of hallmark, what he does differently than other people in the profession is he does PET scans of everyone's brains. And he's identified people who have ADHD symptoms kind of fall in one of 7 buckets with what their brain scan looks like. And that's what the brain scan looks like is dependent on the underlying causes of the ADHD. So for example, we're going to talk in a second here about processing speed being low processing speed being a major cause of ADHD. Well, if low processing speed is present, you can see that on a brain scan, and that's going to fit into one bucket. Those are not the terms he uses, but that's what the difference is. And again, it comes from, are you looking at traditional medical diagnosing? Are you looking at treatment? And that's where the discrepancy comes from.
Gotcha. Thank you for that. And I'm going to throw it back just real quick because I think you can swing this one. Donna Schwartz has asked, are the symptoms similar with trauma versus ADHD?
Yeah, great question. We could do an entire day on trauma and ADHD. I actually do a whole workshop on traumatic brain injury and ADHD, which overlaps a lot with trauma, but then there's trauma. So yes, the simple answer is part of good diagnostic processes are sorting out which of the symptoms are due to trauma and which of the symptoms are due to actual ADHD. And that's where thorough diagnostic and rigorous diagnostic practices come into play of really digging pretty deep so that we can start to sort out these symptoms that all look the same. I just recently had a patient that we did this with who the family came to us because they thought it was ADHD, but when we really dug in, there had been some significant trauma, and it wasn't prudent to diagnose this person with ADHD. They would have gone down the complete wrong path of ADHD treatment, potentially pharmaceuticals with significant side effects, if we were just treating her symptoms and then making the assumption that that was ADHD. The trauma has to be unpacked and dealt with, and some healing occur. And with that, the ADHD symptoms should diminish because through testing, she doesn't actually really have ADHD. And so we can see that. But it's a really biggie to keep on your radar when you're working with clients and trying to determine how to help them and how to direct them, that if there is a history of trauma, it's not very prudent to slap an ADHD diagnosis, even with ADHD symptoms with the trauma present.
Perfect. Thank you so much.
Yeah, absolutely. So Dr. John Rady, another great book suggestion. He wrote a book, I'm spacing the name of it, about talk about memory and cognitive function, right? But he wrote a book called The User's Guide to the Brain, but he also wrote a book called Spark, which we'll talk about exercise in a few minutes. And that Spark book, whoops, I didn't realize I was bumping my mouse. There we go. He wrote this book that explains a lot about ADHD and exercise and how to use exercise effectively. That said, he is an ADHD researcher at Harvard Medical School, and he states that 92% of cases of ADHD are actually caused by one or more deficits in cognitive function. Back to that base of the pyramid. The 3 areas that most commonly cause or associated with ADHD are weaknesses, of course, in attention. That's one of our cognitive skills. Short-term memory, which is often referred to as working memory, and processing speed. So let's look at processing speed. I promised that was coming up as just an example. You can think of processing speed as basically like your brain's internet speed. If it's slow, it's like you've gone to the Apple store and you bought a brand new MacBook Pro with all the bells and whistles, and then you bring it home and you plug it into dial-up internet. What's going to happen if you can even find such a thing? The computer is fine, right? There's nothing wrong with the computer, but it's going to seem like it's broken. If you don't understand that, you're probably going to take it straight back to Apple and go, I don't know what's up with this piece of junk, right? It doesn't work. You probably can't even open an email, much less stream a movie. It's how this is with the brain as well, with slow processing speed. The brain is like a supercomputer that's plugged into dial-up internet when we have slow processing speed. So it causes the brain to zone out, to lock up, to always be behind, to miss information. In some people too, the body subconsciously tries to speed this up. Just like when you're working on your computer and you have a slow connection, and why do we do this? We press the mouse like 15 times or the enter key over and over, trying to hurry it up. that doesn't work, right? It probably actually slows it down worse, but the body will try to do that. And so you'll get fidgetiness and restlessness and moving around as you're trying to compensate for the slow processing speed. We often say the slower the brain, the busier the body. So with this example, it's easy to see how processing speed alone can cause many of the ADHD symptoms. So we also know there's a strong connection between ADHD, mental health, and addiction. So rates of mental health issues, including addiction, are 4 to 5 times higher in adolescents and young adults with learning disabilities or disorders such as ADHD. Studies also show that 60% of adolescents and young adults in drug and alcohol rehab also have a learning disability or ADHD. So if you have a person that you're working with that's being treated for substance abuse, odds are they have some cognitive deficits and some learning issues. And these issues, of course, impact the effectiveness of addiction treatment and other mental health therapies. If your brain isn't processing information right, if you're not being able to focus, if you're not being able to remember, if you're not having good logic and reasoning, all of that is going to impact negatively the effectiveness of treatment. So we can think of substance abuse specifically. I just want to take a little detour on substance abuse and how it relates to this with cognitive function as a negative cycle. So substance abuse causes damage to our cognitive skills, which are responsible for our IQ and intelligence, our thinking, our learning, our problem solving, and our attention. This is also the part of the brain that allows you to weigh pros and cons. It's what allows you to connect consequence with behavior. And we know that substance abuse damages that function. And then many people with substance abuse issues also have learning difficulties, disabilities, and disorders such as ADHD prior to using. A common reason for using is poor decision-making because of those cognitive deficits. On the flip side, we also see that using causes those cognitive deficits, and now you've compounded the issue. And then people who engage in substance abuse also happen to have a higher rate, not surprisingly, of concussions and traumatic brain injuries. And these cause further damage to the cognitive function and ADHD-like symptoms. So you get where all of these are just in this mix and they're all working in this negative cycle together. You may ask, why does this cycle exist? How do substances actually damage cognitive skills? When I talk about this, I always think back to, I'll date myself, but my childhood of like, this is your brain on drugs with the egg in the frying pan, right? I don't know if they still have those anymore, but probably not. But what actually is happening? How does substance abuse actually impact the cognition? And the answer to that is that substance abuse damages the neural networks and the ability for the neurons to fire and wire together, which is what allows our cognition to work. And it breaks down the communication of those neurons and thus lowers our IQ and cognitive function. So I'm going to read you this excerpt. I know that you can read, but I want to read it word for word from Dr. Thomas Gould. He is at the NIH, and his description is just so spot on to it that I don't want to mess it up by summarizing. So his studies show that the brain regions and neural processes that underlie addiction overlap extensively with those that support cognitive functions, including learning, memory, and reasoning. And later, he specifically states attention as well. Drug activity in these regions and processes during early stages of abuse foster strong maladaptive associations between drug use and environmental stimuli that may underlie future cravings and drug-seeking behaviors. With continued drug use, cognitive deficits ensue that exacerbate the difficulty of establishing sustained abstinence. The developing brain is particularly susceptible to the effects of drugs of abuse. Prenatal, childhood, and adolescent exposures produce long-lasting changes in cognition. So important to understand this. This scan on the screen is actually from Dr. Daniel Amen, and it's a scan of someone who has been engaging in substance abuse. If you looked at a healthy brain on a PET scan, we're seeing a three-dimensional model, you would not see any holes there. So those holes are where the drug use has damaged the neural connection and actually literally created holes in the brain. Not good, right? So finally, to put all these pieces of the puzzle together, I would like you to look at another pyramid. I guess I like pyramids, right? But we'll look at the impact cognitive skill function has on recovery. I call this the recovery pyramid, and you can see that again, the cognitive function is at the base or foundation of it. The health of cognitive skills directly impacts the ease and success of recovery. Because again, if your brain's not working well, how are you going to learn strategies and change behaviors? It's really hard to do these things if the brain is not functioning correctly or optimally with strong cognitive skills. So we have a platform when we have strong cognitive skills, we have a platform to learn strategies such as mindfulness, radical acceptance, coping mechanisms, the things that you'd be learning in rehab, counseling, group therapy, whether it's CBT, DBT, you name it. Then there's much greater success when we have these strong foundations of actually changing our behaviors, such as motivation, stress management, sound decision-making, right? All of those things. And we can utilize our support systems and self-management tools, et cetera, to be able to implement those.
You ready for a question?
I am.
Good. Eric says, with substance and ADHD, how best do we address the label of drug seeking when people who abuse substances are also wanting medication for ADHD?
Yeah, great question. And there's not an easy answer in terms of sorting that out for people, because the reality is that we do find that for many people that are sober currently, that the ADHD medications have a similar effect to the drugs that they were using. So even if they maybe were not intentionally drug seeking, it actually is counter to their sobriety to utilize the ADHD medication. Now, there are lots of opinions on this, and there's a spectrum of approaches to it. So I will answer from mine, but I will, again, with the disclaimer that this is not the only perspective, and nor does that probably means it's not the only right perspective either, right? So my approach is I always look at as ADHD medications in general, but also in particular for someone with a history of addiction as a last resort. The good news is that ADHD is not a medication is not a necessity, right? It's not like you have an infection and you need an antibiotic. Like no one's going to die from not taking ADHD medicine at the base level, right? So what we typically look at are what are actually alternative ways to treat this ADHD that are frequently equal in effectiveness to the medication, and most often more effective for long term. And so that's a piece there. I think if you are needing to go down a pharmaceutical route for treatment for someone, then it is really important to have a clear diagnosis so that it can be explicitly shown that there truly is ADHD separate from drug seeking behavior to establish why that the medication is appropriate in that case.
Thank you.
You're welcome. So if cognitive function is so foundational to reaching potential in school, work, life, as well as a crucial part of recovery, the next question that's usually asked is, what causes the cognitive skills to be low to begin with? Like what would create that weak foundation? We've already addressed some of it. Traumatic brain injuries can cause deficits in that function. Substance abuse can cause effects in that side effects or impact in that cognitive function. But where does it come from? Like when you have someone that's born with this, when it's true ADHD, and it's what's called the neurobiological disorder. So there are a few factors to consider. First are neurological factors. And this is pretty fascinating. In people with ADHD, there's actually a delay in posterior to anterior cortical maturation, and the prefrontal cortex develops later in life than in the neurotypical brain. That's a mouthful, but basically what it says is the maturation, the maturing of the brain in these neural connections is delayed and takes much longer in the person with ADHD than someone who doesn't have it. With this delay, we see this that the processing speed, the working memory, and the attention don't develop the way they would otherwise. And these are the areas that cause ADHD symptoms. We also see reduced brain volume overall. The brain will weigh less, and increased slow brain waves, which can be measured with an EEG. These are connected to the slow processing we discussed. So you'll see on a wave pattern on an EEG, much slower longer stretched out, more slow wave patterns. And that, again, when the brain is in that slow processing, just like your computer on dial-up, it's going to sit there and just be spinning and locking up. So this is why ADHD is considered a neurobiological disorder, because it's something that's actually structural with the brain. Secondly, we tend to hear the most about this one, and it's actually the most controversial, but that is neurotransmitters. So in some people with ADHD, we do see a dysregulation in the system that controls the amount of dopamine and norepinephrine available in the synapses of specific parts of the brain. And this is where you get these terms like they have an imbalance or they have a deficit in dopamine or something like that. And it's not quite as simple as that. It's pretty complex. Again, we could do an entire, like semester in neuroscience on what's actually happening with this, but we do see a dysregulation of this system. And then these two issues, the neurological factors and the neurotransmitter issue, both do have a genetic factor. Now, there's no one gene that's been pinpointed as the ADHD gene, but these issues are highly heritable. If one parent has ADHD, their child will have a 50% chance of having ADHD. So that's about as strong of being genetic as you can get in terms of the chance. An area of burgeoning research is really fascinating. This is where I've been spending a lot of time, is in looking at environmental factors. And we know, for example, that low birth weight, lack of oxygen, physical trauma at birth, environmental toxins, emotional trauma, digital media overuse, substance abuse, brain injury can all cause ADHD symptoms. So that's back to that question earlier about trauma and the symptoms. So in fact, the current recommendation, this is one thing I just like to note, the current recommendation for children with digital media overuse, such as like a video game addiction, is for them to be off video games for 30 to 45 days before testing for ADHD so that accurate results can be achieved. There are more and more clinics who specialize in ADHD diagnostics who are requiring this before proceeding with assessment because it's really hard to diagnose. At the Nectar group, we do go ahead and assess because we found some families, until they have some more information, are not willing to tackle that video game addiction, but it makes us hamstrung a bit in giving accurate diagnostics. And sometimes we have to delay a diagnosis while we get to the bottom of that digital media overuse. So just kind of an interesting thing that's unique to our culture and time we're living in, right? With technology, that's obviously not going to go away anytime soon. So if there are symptoms of ADHD, the first step, as I've referenced already, is to really seek accurate diagnosis. And it's important to flesh out if it really is ADHD. There's many symptoms that present like ADHD, but might coincide with something else entirely. And without testing, misdiagnosis is really common, and correct treatment for whatever is going on or for the ADHD can easily be delayed. So in a nutshell, there's really two methods for diagnosing ADHD. The first is based on symptoms. This is the most common, and it's most often done with a pediatrician or a doctor or other clinician. They'll provide the client, or in the case of a child, the parent and teachers surveys. You're probably familiar with this, things like the Connors surveys to be completed based on observed symptoms. And if you have enough of the symptoms, the result is a diagnosis. One of the things to remember about this type of testing is that there is no evaluation of the root causes, and so it won't flesh out comorbidities. Therefore, we have a high rate of misdiagnosis or missed diagnoses of co-occurring disorders. So the focus of this approach is typically on symptom management, how to cope with your symptoms, or how to use pharmaceutical intervention for symptom management. The other way to diagnose ADHD is through assessment done with typically a clinical or neuropsychologist. This involves a client, and if it's a child, parent interview, test of cognitive function, looking at all three tiers of the pyramid, For students, if they're in school, test in academics and reading, writing, math, even sometimes with adults, if we think there might be dyslexia or something, adding complexity to the case. This is going to be really looking at the root causes as well as co-occurring disorders such as dyslexia, anxiety, auditory processing disorder are some of the most common co-occurring issues. This type of diagnosis is obviously much more comprehensive, and the focus is on treatment of the root causes through a complete biopsychosocial treatment rather than just symptom management. This is, for full disclosure, the type of assessment that we do at the Nectar group, and that I personally believe is very important. So, most exciting part is how do we actually treat ADHD holistically? By holistically, I mean going beyond symptom management to actually improve the function of the brain. As one of the doctors that we refer patients to when they need medical care in conjunction with this says, no one is born with a Ritalin deficiency. So the question is, how do we get to the deficiencies that we do have and actually treat them? And the key question around treatment is, can we improve cognitive function and thus treat ADHD? Can we improve those skills on the bottom of the pyramid? And if yes, how do we do that? So great news for all of us is the answer is a resounding yes. We can treat ADHD by treating the underlying weak cognitive skills through a therapy called cognitive training. So I'm going to explain how this therapy works. And note, just a side note, cognitive training is different than cognitive behavioral therapy. We're not talking about CBT here. We're talking about cognitive skills training. This is my area of expertise and the therapy that that we offer at the Nectar group as well. So we can actually see cognitive deficits on a brain scan, such as an fMRI. What you're seeing on the scan at a basic level is individual neurons fire and wire together to form neural pathways that are called white matter tracks. So you have a track for each of your cognitive skills. I could show you images of a brain scan showing you the processing speed track or the auditory processing track, et cetera. And these tracks work together to form neural networks. And you can think of these as like a highway system in the brain. If you were to look at someone's pathway who's weak, we'll just keep going with our example. We started with the processing speed. So if you looked at someone's pathway under imaging that's weak, we would see their pathway is narrow and bumpy versus someone who is strong in processing speed, it'd be wide and smooth. And this is because the person with weak skills has less neurons that have fired and wired together to lay down that smooth, wide pathway. The analogy that's used all the time is that the person with the weak skills has a dirt road versus the person with the strong skills has a paved highway. So the way that we treat processing speed in that example or any other cognitive deficit is we need to pave the dirt road. And this is done quite simply through mental exercise. So we all know that if I have a weak bicep, I can do bicep curls and push-ups. And if I do that frequently enough, and for a long enough period of time, right, I'm going to eventually look in the mirror and have a bigger, stronger bicep. The same is true with the brain. It just builds white matter versus muscle. And so in cognitive training, the cognitive deficits are identified through testing, and then the client works out with a cognitive coach, kind of like a personal trainer for your body, but for your brain. And they take them through a series of exercises developed in the field of neuroscience that target the specific areas of weakness. There's a law in neuroscience you may be familiar with. It's at the heart of neuroplasticity, or the brain's ability to change. And it's called Hebb's law. And it simply says neurons that fire together, wire together. The really cool thing is that once these neurons fire and wire together, they don't come apart very easily. You need something to forcibly interfere, such as a concussion, disease, substance abuse. So this therapy is a corrective measure that treats the primary cause of the ADHD symptoms when they're due to those cognitive deficits. We actually see 70% of people who are on ADHD medications come off their meds within 6 months of cognitive training. So it's a very effective therapy at really getting to the root of it. Once the cognitive skills are improved, many clients really benefit from study skills and executive function coaching to build that top of the pyramid. The cognitive dysfunction is what caused those skills not to develop in the first place. And now that the cognitive skills are intact, they can tackle that, those executive function skills. But we want to make sure that the underlying skills are strong first for this type of therapy to be effective. We do the study skills and executive function coaching at the Nectar group, but there's other places that do that as well, of course. And so what we recommend is that whether you work with us, a client works with us, or they go somewhere else, that they're including these areas that are on your screen right now to target. We do, some of these may not be relevant for an adult client, but for, this isn't all encompassing for students as well as adults. Looks like we have a question, Christy.
We do. So is there research on how well this works for people also experiencing increased symptoms due to RSD?
Yes, but there's limited amounts of research on this. So theoretically, it could be helpful, but we don't know enough for me to say like, this is the percentage or this is like a sure thing. So we take with some of these things, it's similar with Parkinson's. We have also people, for example, with MS who have deterioration of cognitive function due to these stroke victims, all different types of things. And with those, this is just too new of a field that those isolated things haven't been studied concretely enough to express a clear answer on that. What we do on it is on a case-by-case basis, look at their whole circumstance. And then sometimes I have to tell clients, like, this would be experimental. Here's what we think the likely outcome would be. And it's their decision to decide if they go down that path.
Okay, following that up, Brandy wants to know if there's peer-reviewed research to support cognitive training therapy that you could share.
Yeah, absolutely. So there's not enough for sure. When I started in this field 19 years ago, so there's a good 40 years of research, but there's still a lot more that needs to be done. It's not real popular research for drug companies to fund because it makes people come off of medications. So there's still a lot more that needs to be done. The most cutting edge places for this, I was trained in this therapy 19 years ago in a program coming out of Berkeley Neuroscience department. The Boston Children's Hospital with a collaboration with MIT and Harvard neuroscience departments have done some of the most brilliant research. There's a researcher there named Nadine Gabe, who a lot of the principles of our therapies are based around the work they've done there in what's called the Gabe Lab. But all of that said, there's a lot of information. So I'm happy to share with you links to that. I've got a resource document of kind of like my top 25 research articles showing that. Some of them are peer reviewed, some of them are not peer reviewed. And there's some books written on this. So I'm happy. Probably the best thing is when you get my email later, just shoot me an email and I'll happily send you some resources. I mean, I'm a bit of a nerd, but I think they're super fun to read and really interesting. So I'm happy to share those resources with you.
Perfect. And along those same lines, there's been a request for you to share some examples of what these drills you just referred to on this slide look like.
Yeah, absolutely. So it's a little bit hard to describe them because they're somewhat abstract and it depends on what you're working on. But for example, processing speed uses a metronome for a lot of it because it's forcing the brain to go at a certain speed. You would be utilizing, we use our processing speed in everything we do. So there would be visual exercises that work on visual processing. There'd be exercises that work on auditory speed of processing. There'd be exercises that work on like skimming text or writing quickly, what's called retrieval fluency, where you're recalling information at a faster level. So each exercise is broken in anywhere from 10 to 30 levels of difficulty. And so we want to make sure that we're working on all of those in an increasingly difficult way and in a way that mirrors how we use those skills in real life. So one of the problems with some of like the brain games or online mind programs is that the game that you're playing doesn't mirror how you use that skill in real life. And so you don't get generalization. You get better at the game, but nothing changes in real life. And so that's one of the major pitfalls. Not that all of those programs are bad or not helpful, but there's a lot of limitations to that because of that. I want to talk about, I'm being sensitive to the time. I have a lot more great things to cover for you guys, but I want to talk about a couple of other therapies that are super important to have on your radar for options for your clients. The next therapy that I sometimes recommend to help the tip of the pyramid is neurofeedback. This is also known as EEG biofeedback. You may be familiar with neurofeedback. It's certainly more widespread. It does not rewire the cognitive function. It's not going to change those cognitive skills on the base of the pyramid, but it is effective at rewiring brain waves and giving some control of brain function to the client. So it's particularly helpful for managing attention, impulse control, and mood. And in neurofeedback, the client will focus on learning how to have more control over brain waves in order to control attention. This is not my expertise, but something I frequently refer clients to. So I can always help you with some good referrals if you're needing that for a patient, or if you just even want to bounce it off of me and see if it's an appropriate referral, always happy to help with that. I also want to talk about a big category, which is supplements and diet. And we could do an entire day's workshop on this. But there are a lot of great options. I do want to always say I am not a licensed medical provider. And so before I would recommend a client starting supplements, they should consult with a physician that's trained or board certified in holistic medicine. But the first action item is to consume a diet that's high in healthy fats, such as coconut oil, flaxseed, avocado, walnuts, fatty fish like salmon, herring, mackerel. My favorite right now is what's called black cod or sable fish or butterfish, and olive oil. So omega-3s in particular are vital. So we do recommend considering supplementing with omega-3s specifically through fish oil. One thing to note is that if a client starts taking fish oil, it's important for them to take enough to reach a therapeutic dose. And the typical recommendation is 3,000 milligrams per day. The average person that takes omega-3s takes 500 milligrams, and they don't see any change because they're not in a therapeutic range. You want to make sure also that it's a high quality, and you want to understand that it doesn't work like a prescription medication. It takes on average 3 to 6 months to see the full benefits. One of the doctors that we work with, his name is Dr. Brunswig. He explains that people with ADHD and other cognitive deficits are typically low in omega-3s. It's like they have a pothole, and every dose of omega-3 that they take are dropping a pebble in the pothole. So it's going to take several weeks or months to fill in that pothole, depending on how deep their hole is, or how big that pothole is. And so it is important just that clients know that this is a good approach, but it's long haul. One other note is that for ADHD purposes, you want a higher ratio of EPA to DHA for optimum benefit. If you have questions about omega-3s further, I have a lot of great research, and I'm happy to send you like some suggested brands. I don't sell any of them or anything like that, but some suggested brands and dosing guidelines from some of the physicians that we work with. The next recommendation is to have their client get their levels tested of what I call the 3 magic minerals for ADHD: iron, zinc, and magnesium. If these are low, they should supplement to bring them up to optimal levels. And a lot of people notice pretty immediate results with these, but depending on how significant their deficit is, they may need more time. All of these play a significant role in neurological function and have been shown to be low in 84% of people with ADHD diagnoses. So this is a biggie one, a big area. And then finally, we want to test for and eliminate food sensitivities. This is the least popular one because it means giving up some foods that we like usually, but it can be done most effectively through a stool test. You need to do a fun poop test versus a blood test is not very effective for food sensitivities, or through an elimination diet. I've seen firsthand just life-changing results when we're reducing foods or when we eliminate foods that can cause inflammation in the brain. And it really reduces the ADHD symptoms. So it makes giving up those foods that they enjoy a lot easier when it's making a huge difference in their day-to-day function. So the rate of food sensitivities is actually much higher in the ADHD population than people without ADHD. So it's really common and certainly worth exploring. Again, I'm always happy to provide additional resources on the best ways to do that. Exercise, physical exercise. We all know that physical exercise is good for our bodies, but it's also very good for our brains. The minimum recommendations for brain health is to engage in cardio exercise 5 times a week for at least 30 minutes each time. The reason for this is that physical exercise actually targets the same neurochemicals that stimulant medication targets. It also increases what's called brain-derived neurotrophic factor. You won't get tested on that. You can just call it BDNF. It's one of the building blocks necessary for strengthening the neurocircuitry of the cognitive function. And just as a little note, interval training is a great way, a great type of exercise to do this. It actually increases over any other type of exercise our brain's production of BDNF. So you're giving your brain some nice building blocks to build those neural connections. The next area that you're probably familiar with again is sleep, but we all know it's important, but it's important to note for people with ADHD that the ADHD brain works in overdrive all day long and definitely has a higher need for rest and restoration. So it's important to help clients practice good sleep hygiene. This can mean a lot of different things, but we want to help them maybe create an action plan to create a relaxing bedtime environment. Having a cool temp room, the ideal sleeping temperature is 68 degrees. You want to make sure it's dark, using blackout curtains or a sleep mask if needed. Make sure it's quiet. Or even better for most ADHD brains is to have white noise via a fan, an air purifier, a white noise app. I use Calm a lot. And then of course, limiting caffeine and screen time are helpful. The good rule of thumb for most people is no caffeine after noon and no screens 1 hour before bed. And then finally, we have mindfulness meditation, something I'm sure that many of you practice or utilize with your clients, but some interesting things is that mindfulness practices, we know, calm the central nervous system and allow our brains to shift to a state of greater focus and attention. Mindfulness exercises are exercises that actually practice attention. This type of practice stimulates the neural connections and helps us actually build new white matter. You can see this on a brain scan in people who have a history of consistent meditation. The field of neuroscience actually classifies mindfulness meditation as brain training because with consistent practice, you can see measurable changes on brain function on a scan. So helping your clients find a tool or develop a practice, even for a small amount of time each day, can be really helpful. I want to finish up our last tool as we're looking at tools for treating ADHD by giving a few strategies for improving focus. Whether it's while completing schoolwork for students or work tasks for adults. The first is to set a focus timer for sustained attention to the work and hold tightly to the work time and break time. So I recommend actually using an egg timer or a stopwatch that's counting down. There's a clock that you can order. They have them on Amazon called the timer, and it actually has a little red pie chart and it counts down your minutes. And the client should just simply start with a length of time that they can comfortably achieve and then build on from there. So we have some clients that literally can focus without distraction for 3 minutes. And their first goal is to work to 5 minutes and then 10 minutes and then 15 minutes. So that's a way to actually strengthen that focus. Next is to take breaks, but make sure to engage in technology-free activity during breaks. This is crucial to really giving our brains the reset it needs for focus. You know, how many of us take a break and immediately look at our phones, right? Or get on there and start doing something there. A great way to do this is to get outside, even just for 5 minutes, and engage in physical activity, some sunshine, air. It doesn't have to be that you run a lap, but stretch a little bit, move around. While building focus skills, technology controls that block access to apps and social media or specific websites can be deployed, and they are a little bit of a crutch, but can be really helpful to start to build that sustained attention. Another thing we see is that setting and sticking to a routine can be very helpful, especially while working on behavior change or while engaged in therapeutic intervention like cognitive training. And then finally, another nutrition tip is to control sugar and processed food intake. None of us perform well with the sugar highs and spikes and crashes, but this is really, it really has a negative impact on the ADHD brain. It doesn't handle or cope with that very well. And so the more we can eat something like an apple with almond butter so that we're getting complex carbohydrate, fat, healthy fats, and protein all at once will keep the blood sugar balance. So helping clients come up with a strategy to plan ahead for some meal prep and food prep for that. So if you have a client that you want to get help to get the root cause of their ADHD symptoms, there are several options, some that we offer through Nectar. We do offer a free cognitive screen. This allows us to see red flags that further testing should be completed, or allows us to rule out ADHD or cognitive function as the cause. So we always offer those complimentary. You can reach out to me if you have a client that you want to refer for that. It's about an hour and 15-minute screen, and then they have a follow-up hour consultation with me or one of our other directors to go over their results and recommendations. We also offer full comprehensive cognitive assessments to look at those indicators of ADHD, full psychoeducational batteries. And then we always offer complimentary review of outside testing to provide a second opinion or to help them create a treatment plan for their ADHD. So they can just set up a consultation for that. So we've talked about a lot. I hope there's some of these things that you can implement with your clients right away or in your own life if you struggle with some of these issues. I've listed here some of the ways we can help that I've referenced all throughout if you're looking for some resources for help. But I hope that you will take these. And my biggest takeaway is always that you understand that there are these complexities underlying ADHD that do have so much hope for treatment and actually correcting those underlying issues. So feel free to reach out to me. Here's our 1-800 numbers wherever you're at. You can call in on, or you can email at getanswers@thenectargroup.com. I will firsthand see that email, and I'm happy to be a resource to you with any questions that you have from here.
Oh, wow. Perfect, Andrea. Thank you. We are right up on the nose at the end of the hour, but I do want to let everybody know that this information on the screen is an easy way to access Andrea. And if you have questions, because there were a couple questions that we were not able to get to, please send those to her. Again, this is recorded. Your survey is coming your way. Certificates go out on Friday. And Andrea, there was several requests for your recommendations on vitamins and all that, and omega-3s and all that kind of stuff. So I'd be happy to include that with the certificates, or if you choose to handle that on your own, that is up to you as well. But very interesting information. Everybody is giving you lots of thank yous, and we appreciate you taking the time to present for us today. And I hope you'll come back and see us next year.
Thank you. Thank you so much, everyone. I'll look forward to answering your questions offline.
Everybody, we are done for 2021. We do not have a webinar in December. I hope everybody has a wonderful holiday, and I look forward to reconnecting with you next year in January. Stay tuned for what is coming your way, what presentations are coming in January and the rest of the year. So take care. Thanks so much.
Perfect. Take care.